How to get a definitive diagnosis for chronic inflammation. Imagine feeling tired all the time, with persistent pain or swelling that just won't go away. You might wonder what is really going on inside your body. Finding out if you have chronic inflammation is a process that takes some detective work. It's not just one simple test but a combination of steps that help doctors piece together the puzzle. First, a healthcare provider will start by asking about your symptoms, medical history, and any risk factors for immune system disorders or autoimmune diseases. They want to know how long you've felt this way and if you have other health issues. This initial chat helps guide the next steps. Next, blood tests are key. The most common ones are high-sensitivity C-reactive protein tests, which measure a protein made by the liver when inflammation is present. If levels are high, it suggests inflammation but doesn't tell you where or why. Doctors often repeat this test over time to see if the levels stay high, indicating ongoing inflammation. Another useful test is fibrinogen, a protein involved in blood clotting. Elevated fibrinogen can mean your body is in a state of constant inflammation. The erythrocyte sedimentation rate test measures how quickly red blood cells settle in a tube. Faster rates mean more inflammation. This test is simple and inexpensive but not specific to any cause. Serum protein electrophoresis looks at protein patterns in your blood. Changes like increased gamma globulins can point to inflammation or immune activity. Measuring pro-inflammatory cytokines, like tumor necrosis factor alpha and interleukins, can give more detailed info but is more complex and costly. These molecules are messengers that promote inflammation. Since these markers are not exclusive to chronic inflammation, doctors often combine test results with your symptoms and physical exam. They may also order imaging tests like ultrasounds, X-rays, or MRIs to see if specific tissues or organs are inflamed. Sometimes, a tissue biopsy is needed to look at a small sample of tissue under a microscope. If autoimmune disease is suspected, testing for autoantibodies becomes part of the process. These are proteins made by your immune system that mistakenly attack your own tissues. Examples include anti-nuclear antibodies or rheumatoid factor. To get a clear diagnosis, your doctor might recommend repeating blood tests over several weeks or months. This helps confirm that inflammation is ongoing and not just a temporary response to an infection or injury. It's also important to discuss your lifestyle, diet, and any medications you are taking, as these can influence test results. In some cases, identifying the exact cause of chronic inflammation takes time and multiple visits. The goal is to gather enough evidence to understand what's driving your immune response. Once the cause is clear, your healthcare team can develop a targeted plan to manage or treat the condition effectively. Remember, the process is about piecing together clues from your body and lab results. It's a careful, step-by-step approach that helps ensure you get the right diagnosis and the best possible care.